HIMT 1350 Midterm Project Research on Metformin by Florence Joseph. Drug reference. Drug name Metformin. The brand name is Glucophage. Generic name Metformin HCl. Dosage and route of administration. It depends on the condition of the person's glucose level and how the state of the person's kidney is. Metformin usually start on a low dose and gradually increase the dose not more than once every 1 to 2 weeks. For example, 500 milligram orally twice a day with a morning and evening meal. How long does it take the medication to be absorbed, and what can affect the absorption rates? Following oral administration, approximately 90% of the absorbed drug is eliminated via the renal route within the first 24 hours with a plasma elimination half-life of approximately 6.2 hours. What is the half-life of metformin? In the blood, the elimination half-life is approximately 17.6 hours, suggesting that the erythrocyte mass may be a compartment of distribution. For what disease or condition is metformin used for? Metformin is used to control blood sugar by improving the cell's response to insulin and reducing the amount of sugar that the liver makes. Benefits of metformin. Metformin helps to control the amount of glucose sugar in one's blood. It decreases the amount of glucose one absorbs from food and the amount of glucose made by one's liver. Metformin also increases body's response to insulin, a natural substance that controls the amount of glucose in the blood. Risks and side effects associated with metformin. Despite all the warm feelings about metformin being the first line of treatment for type 2 diabetes, there are some risks associated with it. This drug does cause a number of side effects, especially when it comes to the gastrointestinal tract. They can be especially bothersome during the first few weeks of treatment. After several weeks, however, the digestive symptoms may fade away. Here is a list of adverse reactions to watch out for: heartburn, stomachache, diarrhea, gas, headache, nausea, loss of appetite, weakness, rash, lactic acidosis, which symptoms may include irregular heart rate, nausea, stomach pain, lethargy, anxiety, low blood pressure, and rapid heart rates. The Is this medication indicated or contraindicated for pediatrics, adults, geriatrics, or pregnant women? During pregnancy, metformin should be used only when clearly needed, or better, the doctor may prescribe insulin as a better option. Overall, there is no sufficient data to prove that metformin is safe during pregnancy. In like manner, its safety and efficacy in pediatrics is not established. Older adults may be at a greater risk for side effects such as low blood sugar or lactic acidosis. Label warnings to watch for while using metformin. A person may experience blurred vision, dizziness, or drowsiness due to extremely low or high blood sugar levels. Do not drive, use machinery, or do any activity that require alertness or clear vision until one is sure it can perform such activities safely. Food and other medication patients should not take while using metformin. Drinking alcohol while using this medication can increase a person's risk of lactic acidosis and developing low blood sugar. In summary, these projects address how metformin is being administered, the effects of metformin on our glucose level, how metformin control the glucose level, and what is being used for, especially to treat type 2 diabetes. And we do mention also the side effect of metformin. We understand from this project that metformin is being administered orally, and we can gradually increase the dose not more than once every 1 to 2 weeks. And metformin is only used for type 2 diabetes and not for type 1 diabetes. And some of the side effects of metformin include heartburn, stomachache, diarrhea, gas, headache, nausea, loss of appetite. Thank you.